And a good Tuesday morning to you, 100.9 FM, 13 WMVO, WMVO.com's AM Knox County program. Thanks for joining us here today on the program. And we're going to be talking with Jake Overholt, Dr. Overholt with Swetlic Chiropractic and Rehabilitation. And we thank him for being in studio with us today. And then Mayor Matt Starr will be in studio as well. So we're looking forward to have two different guests in studio, as yesterday we had nobody in studio. So it kind of reversed the roles there. But certainly appreciate Dr. Overholt joining us here on the program. Before we get started, want to wish a happy birthday to Scott Eric. Lance Spearman says you were his favorite roommate at Capitol. He didn't say if you were his only roommate. Sorry. So, Dr. Overholt is with us, and we appreciate him joining us. We do want to thank Tim Hortons Coffee and Bake Shop, Coshocton Avenue in Mount Vernon. It is always fresh. As we like to do, when we talk with Swetlic Chiropractic and Rehabilitation here on the third Tuesday of the month. It's kind of a rotation of the doctors there. We had Dr. Jenkins on last month talking with us about more of the therapy side of things, and Dr. Jake Overholt is with us as well. Tell us a little bit about yourself, how long you've been actually involved with Swetlic Chiropractic and Rehabilitation, Dr. Overholt.
Yeah, I started with Dr. Swetlic right out of chiropractic school, and I've been with him 14 years now, so feel like we've got a really good thing going up here on the hill.
All right. And I can just be honest with you. People tell me, well, there are some people that tell me I look old, but there are some people that tell me I look young. And I think Dr. Overholt actually looks younger than me, and I'm a young guy. So
yeah, and I hit the big 40 this year. So
and I'm 30. So he's looking like he's 30. Well, we appreciate him being in here and talking with us. In terms of you and Dr. Jenkins and Dr. Swetlic and working together, do you guys kind of have different roles? Do you just have different patients that you care for? How does it work in terms of splitting up the workload there?
You know, I feel like we all work together, and
Sure.
it's like sometimes I'll see some of Dr. Swetlic's patients, sometimes he'll see mine. Typically, we like to see a patient through a treatment plan and keep the same doctor, but we have each other's backs on that. And then Dr. Jenkins, on the therapy side, we do a lot of work with him, have a great system as far as referral. There's a lot of things that we can only do with chiropractic, and we need to go the extra step, and that's where Dr. Jenkins can come in with the physical therapy, address the muscles and balance and all that.
All right. And you're a local guy here, right? You've been around here, right?
Yeah, I grew up in Fredericktown, graduated from Fredericktown, and then I went to Miami University for my undergrad, and then Logan College of Chiropractic, which is out in St. Louis.
All right. There you go. So we appreciate Dr. Overholt being here. I was going to joke with him about Fredericktown. I won't tease him about that. But we appreciate him joining us here on the program and chatting about some of the things that are happening with Swetlic Chiropractic and Rehabilitation. And, you know, every time, it actually was kind of nice for a little bit having you guys on the phone, because then I could slouch in my chair and you guys wouldn't have to yell at me, because it is hard to keep a good posture. And when I was in high school, I remember a doctor, it wasn't an actual chiropractor, but a different doctor, kind of a general doctor, said, yeah, your posture's terrible, you know, or whatever. So posture, is that kind of the main cause of people's injuries? I know there's a lot of different things that can happen with people. So
we see it more and more, especially now with things being, you know, computerized.
Yeah,
a lot of
sure.
people sitting at computers. And now in the COVID era, a lot of people working from home, maybe not the best setup. So those daily postures start to build up and create imbalances and weaknesses, which then lead to spinal problems, muscle problems. And that's when we have patients come to us in pain.
Yeah. And it's not just like, hey, I sat wrong one time, because I know, like, when I'm sitting in here, it is, you just kind of, you fall right into it. You know what I mean? And you try to sit up, but you fall right into it. But it's almost like a pattern, and eventually it starts causing the problems, right?
Yeah, sometimes it takes a conscious effort to sit with good posture.
Yeah.
And just like any other muscle in our body, our postural muscles fatigue. So, you know, you're sitting that way all day, they start to get tired and you start to slouch. Or, you know, you may not have your computer set up the best way, so you're turning your head to the side slightly, or you've got your shoulders twisted. So there's certain things that can add up throughout the day that can give you problems like that.
Yeah. Is it more of like a disc issue, like when you don't have bad posture? Is it something with your spine, or your spine misaligns or something? Or is it
all of the above?
Okay.
So, like in the low back, that prolonged sitting posture, sitting has been proven to put the most pressure on a lumbar disc. So your low back discs.
Yeah.
So disc problems can happen from prolonged sitting. With slouching postures, you can get muscles that start to stretch, and it's just over time they're lengthening, and it becomes inflamed and irritated, so the muscles can get irritated. Certain postures will close down canals where nerves come out, so then you can start to get nerve problems. So, I mean, it can affect all of those tissues that have to do with the spine.
Yeah, and you probably see this more with older patients, right? Or is it younger patients? Maybe with older, I'm saying because maybe you wait longer and it's been 40 years and you're finally getting worked on. Or do you see it with really younger and older patients?
I see it in both.
Okay.
Nowadays, with the younger population, you probably heard the term text neck going around.
Yeah.
So everybody's got a cell phone, and these kids, they can't seem to pull themselves from it. So they're always looking down. And over time, they start to lose. You're supposed to have a little bit of a curve in your neck, and that's just how we're built. But over time, with prolonged looking down, you lose that curve, and the neck straightens, and then it creates extra tension on the neck muscles on the back, which can lead to other problems like headaches. It just snowballs from there.
Yeah, that's one of the things that, like you mentioned right off the top about technology, and people get to sitting at their computers and they're working on their computers and things like that, and they just start slouching down. And really, it just starts feeling comfortable, because I know even with me, like if I'm trying to sit up and really, it kind of feels uncomfortable at first, right? Yeah. I mean, and is that how it's supposed to be?
No, I mean, you should feel comfortable sitting properly, but it's so a lot of times we become flexor dominant because our shoulders are rounded forward, we're slouching. So all of our chest muscles, all those are shortened and tight. And then our back muscles become weak. So there's a tug of war there going on, and those tight, short muscles in the front are winning that tug of war. So then when you go to sit up straight, those muscles are tight, and the muscles on your back are weak. So it feels weird. You're not used to it.
Yeah, so it takes a little bit of time then it's almost training your body to accept the fact that you're going to have good posture, and then, like you say, it's kind of self-conscious after that, right?
Yeah.
So, again, Dr. Overholt is with us, Swetlic Chiropractic and Rehabilitation. What are some main tips you would give people that are maybe saying out there, I do just slouch so much and I just can't help it, I just don't know what to do? What are some of the tips for people to have better posture that could help them in the long run?
Well, there's all kinds of core strengthening exercises out there. You've probably seen the big physio balls that you can sit on, working on pelvic circles, pelvic tilts. That's going to fire those stabilizer muscles in your abdominal area and help you sit up straighter and stabilize your spine. Getting into some extension exercises where you're pulling your shoulders back like rows. That's going to strengthen some of those scapular mid-back muscles to pull your shoulders back so you're not rounding forward. And then up in the neck, a good one it's called a chin retraction or neck retraction, but you're basically keeping your head level, but it's like you're trying to give yourself a double chin. So you just take your head straight back, and that'll strengthen some of those deep neck flexors that are now weak and giving you that forward head posture.
Yeah. Well, again, Dr. Jake Overholt is with us here. We're going to be talking about some other things as well, but I know that he's probably going to leave here thinking I have terrible posture, but I'm trying to make sure that I'm sitting up here. And like I say, I've been told that for, gosh, man, I was in middle school probably when they first started telling me I had bad posture. So is it tougher with taller people? I mean, just because of the fact that they're taller and it's just,
I think it is. I feel like our world is not set up for tall people. So a lot of times they have to compensate. They're bending over, they're looking down more. So I feel like taller people do have a lot of issues, back issues and postural issues.
One of the things that I did, it's been probably 4 years ago now, is I went on this keto diet. I just couldn't keep it up because it was just like I needed pizza in my life. But I went on this keto diet, though, and I lost like 23 pounds in 2 months and things, and I actually gained height. Because my spine started to straighten, I had lost some weight, and everything started to straighten up. Is there a correlation there with weight as well? Yeah,
the weight definitely adds it adds stress to your joints. So down to the knees, for every pound overweight you are, you multiply that by 4, and that's how much extra pound is on each knee. And then like a abdominal fat, it pulls your spine forward and it jams your lumbar facets, it's the back part of your vertebrae. So people with large bellies get low back problems because it's always pulling. It's the same thing with pregnant women. That as the baby gets bigger, it pulls the back forward and it irritates the low back. So yeah, weight definitely can contribute to your back problems.
Dr. Jake Overholt is with us, Swetlic Chiropractic and Rehabilitation, just down the road from us here. There's a running joke that I would be able to get there without a GPS, which I would, but people saying that I wouldn't be able to. But Dr. Overholt and I will be talking a little bit more about some nerve things and obviously some more about care and therapy at Swetlic Chiropractic and Rehabilitation. But we're going to take this break. We'll come back and more. AM Knox County coming up. Welcome back. It is AM Knox County, and it is a Tuesday. Thanks for joining us, the third Tuesday of the month, and that means that we're talking with Swetlic Chiropractic and Rehabilitation, and kind of have that rotation of different doctors that come in, and Dr. Jake Overholt is with us here, and he's just lucky it's not week 10 of high school football season when the Freddies play the Trojans. Now, I don't think he's going to have to worry about it being in here on that one, because I don't know if that's the same week, third week, but hey, if it is, then I'll have to joke around about that. But Centerburg and Fredericton have always had a rivalry. Anyway, Dr. Jake Overholt with us, and we talked about posture and things, but let's talk about nerves. And this is something that when you think about it, probably is the reason people more than likely come in, because they have all this nerve pain, and it just won't go away, right? And so like a pinched nerve and things like that, that's a pretty irritating thing.
Yeah, I mean, the nervous system, if you kind of think of it like the electrical system of the body. So you have the brain, which is the control center, the spinal cord, which runs down the spine, and then it spreads into spinal nerves, which come out of little holes on the sides of the vertebrae, and then supply the rest of the body. It supplies every cell in the body, supplies every muscle, every tissue in the body has nerve supply. So with chiropractic, we're looking for areas where those nerves are irritated, and we're trying to take that irritation away so that you function properly. But we were talking about posture, and so many postures can lead to nerve irritation, whether it's just chemical irritation, which is inflammation around the nerve, or mechanical irritation, which is a tight muscle that's squeezing it, or even worst case scenario would be like a disc that's herniated and touching the nerve. So there's different things that can irritate nerves, and it's our job to try and narrow it down and then pick a treatment plan that's going to address that.
Yeah, I heard like pinched nerves before. What does that actually mean? Like if it's a pinched nerve, somebody didn't come up and just pinch you in the back, but like a pinched nerve, what does that mean? Because I've heard that causes quite a bit of pain. Yeah,
so typically it's something is touching the nerve, and and the most common like pinched nerve would be the disc. And it's if it's real bad, it's a herniated disc, which is like, if you think of the disc, the discs are the shock absorbers between the vertebrae, and they're like a jelly-filled donut. And every now and then, the outer ring of that disc will weaken or tear, and the jelly part in the middle will bulge back at that weakened spot. And worst cases, it'll bust through, and that's called a herniation. So that disc material will bust into the canal that the nerve comes out, and it can actually be touching the nerve, which is like a pinched nerve, or it can cause inflammation in that area and cause chemical irritation. You still get nerve symptoms even without it physically touching it.
Yeah. Does that happen a lot? Do you see that a lot in your office?
Yeah, that's something that comes through our doors quite often, and it's most commonly lumbar discs that we see, but there's cervical discs as well, which is the neck. More rarely we'll see thoracic, which is mid-back. Those discs don't herniate as much as lumbar and cervical discs.
Yeah. And are there nerves in the neck? You talked about we talk about posture and kids looking down at their phones. I say kids, I'm 30 years old, and but kids looking down at their phones and things like that. Is that part with nerves there?
It can. Yeah. And the way the way we're wired around the neck is there's a nerve that comes out on both sides of each vertebrae, and then it forms a plexus of nerves that goes through under the clavicle, through the shoulder area, and then they go down the arm. So neck nerves supply the arms. So a lot of times what you'll feel with an irritated nerve in the neck is numbness, tingling in the arm or certain fingers, might even feel weakness. It can be a shooting pain down the arm. So there's symptoms that kind of point us towards a nerve, and it's usually the numbness, tingling, or like a burning, shooting pain.
Is that like a stinger in football? Is that kind of the same thing?
Yeah, so a stinger in football is that plexus of nerves in the shoulder that I was talking about.
Yeah.
It's when the neck and shoulder get a sudden stretch, and it stretches those nerves, and then it just sends a zinger down the arm, and then you get the nerve symptoms.
We talked kind of about some of the preventative measures we can take with posture. What are some of the preventative measures maybe to even strengthen our nerves? Is there something you can do in regards to that? Just making sure your core's strong, kind of like we said before?
Yeah, I mean, the things to prevent nerve irritation are working on your posture so that all the canals are open as best they can be. So that can be postural exercise, that can be coming and getting adjusted so your vertebrae are aligned and those foramen or those holes that the nerves come out are open. There's treatment options like cervical traction, which it's basically decompressing the spine and opening up. It's gentle. It's not like you're hanging by your neck or anything like that. Sure. But it gently pulls on your neck to open up those spaces as well to make room for nerves.
All right. And that's obviously something you guys, as you mentioned, you treat over at Swetlic Chiropractic and Rehabilitation, and you mentioned the lower back issues. I know that they've helped me with that quite a bit, and I found out that apparently one of my legs is like 7 centimeters shorter, millimeters or whatever, not centimeters, millimeters or something shorter than the other one. And it's like, you go to see a chiropractor and you can find out a lot of different things, and they can obviously help you out as well. So we talk about Swetlic Chiropractic and Rehabilitation. The services, the referral from a doctor, or people can just come in, right? Either one?
People can just come in and, if it's a chiropractic problem, we don't need a referral for that. We can treat that. Now, physical therapy is a little bit different. Most insurances require a prescription for physical therapy, and it typically has to come from their medical doctor or nurse practitioner or a DO. It can't come from a chiropractor. The insurance companies recognize the referral from the medical doctor or, like I said, nurse practitioner. So in order to see Dr. Jenkins, a person needs to have that prescription for physical therapy for their insurance to typically cover it. Now, not all insurance, some insurances don't, but to play it safe, it's usually a good idea to have that ahead of time.
Well, and you could either come to Swetlic Chiropractic and Rehabilitation, just get the chiropractic side, just get the physical therapy side, or if it's a situation, maybe you do the chiropractic side and then you transition to physical therapy, right?
Right, yeah. And that's what I think some people don't realize is that the physical therapy department, you don't have to see the chiropractor to see physical therapy. I mean, we have a lot of doctors in the area that have a good referral source with Dr. Jenkins and send people to physical therapy for conditions that don't require chiropractic. So don't think that just because we're a chiropractic office that you have to see the chiropractor. You can do physical therapy only. And then same with on the other end of you can come just for chiropractic. Not everything's a physical therapy thing, but the nice thing is we have both there if you need both.
Yeah, exactly.
And I've had patients where they came in for a chiropractic initially, and I thought, I think I can take care of this. It seems like an alignment issue. But then they're progressing, and then we hit a wall, and then I realized, well, actually, I think there's something else that can be done to get them over the hump, and it's physical therapy. So it's nice to have that option. All
right. So Swetlic Chiropractic and Rehabilitation is just down the road from us here, as we mentioned. What are your hours? What is the address as well? It's Upper Gilchrist Road, but tell us the address and tell us when you guys are there.
Okay. We're up here at the corner of Upper Gilchrist and Yager Road. It's 11301 Upper Gilchrist Road.
Put him on the spot.
Yeah, I had to think about that. We are taking appointments from 8 to 1. Now, people, that's deceiving because we do come early and stay late for follow-up appointments and stuff. Sure. So people sometimes get a little bit edgy about our hours, but we're there longer than that. So I hope people are understanding of that. You can call to make an appointment. Our number is 740-392-1407. Let's let's see, I'm trying to think. Yeah, if you're wanting to look into physical therapy, like I said, it's probably a good idea to have a prescription for it. That helps make things go a little smoother.
All right. Dr. Jake Overholt, Swetlic Chiropractic and Rehabilitation. Thanks so much for coming in and talking with us, and appreciate you spending some time giving us an update. I hope that I didn't slouch this whole time. I don't know. I tried not to, but we appreciate the updates and the great information about posture and nerves as well. And give a call to Swetlic Chiropractic and Rehabilitation. Get in contact with them and get set up and get you feeling better today. There's no point in being miserable. You might as well give them a call, and they'll get you figured out there. So